We try to explain to the parents as best we can what we would expect based on the studies that have been done. We can't always predict that, of course, but we try to be realistic and tell them that the child might have a shunt placed for hydrocephalus or fluid on the brain. And if so, that's often done right after birth, but it might occur months down the road or even up to a year or more. Their development we would foster to be as close to normal as possible, even if their legs were partially or fully paralyzed. There are things that we can recommend in terms of bracing and mobility to get them mobile and functioning in preschool, in school, in society as a young adult. There are things that can be done to help them with bladder and bowel incontinence so that they can eventually get into wearing regular underwear just like any other child would after toilet training age. They might need to do different things, but it certainly can be achieved. Now with medical advances, with intermittent catheterization, with shunting that's much better, children are living into adulthood. Children are becoming functional members of society. There are associated learning disabilities that go along with children that have spina bifida, and especially those who have the hydrocephalus and need a shunt. But those are usually well identified and with good testing and good monitoring, and can be monitored and assessed so that the educators and parents and the workplace would be informed and brought up to speed with what those disabilities are and how one can be educated and get a job and live a full life.